Now moving on to the pathology questions. A patient with spontaneous bleeding presented to the hospital where he underwent investigations. This reveals presence of blast cells more than 25% with the image shown. Then the translocation was asked, and the answer is translocation 15 to 17. The next question is a patient has tumor which shows tumor cells with CD5 positive and CD23 positive. Which of the following is the best investigation to detection of CD molecules in tumor cells? And the options were option A, ELISA, option B, flow cytometry, option C, southern blot, and option D, routine staining. And the correct answer is option B, flow cytometry. CA125 is elevated in which of the following conditions? And the correct answer is option B, serous cystadenoma. Next question. Male presents with gradually increasing testicular mass and histopathology of the testicular biopsy was shown and the diagnosis was asked. And the correct answer is option A, seminoma. Next question. True about a female with dry eye and dry mouth having antibody regarding her biopsy finding is lymphocytic infiltration in salivary glands, neutrophilic infiltration in salivary ducts, eosinophilic infiltration in ducts, deposition of amyloid in exocrine glands causing dysfunction. And the correct answer is option A, lymphocytic infiltration in the salivary ducts and glands. The next question is patient presented with lymph node enlargement which on examination had tumor cells with CD10 positive and BCL2 positive, and the translocation was asked, and the correct answer is translocation 14 to 18. The next question is a teenager has jaundice, anemia, splenomegaly, and he has positive family history of the same condition with increased MCHC. What is the likely diagnosis? And the correct answer as taught by Dr. Sparsh in his pathology mission videos is option A, hereditary spherocytosis. The next question, caspases are involved in which of the following conditions? And the answer is option C, apoptosis and pyroptosis. The next question is maternal inheritance is seen in which of the following conditions? And the correct answer is option B, Kearns-Sayre syndrome. Which of the following best describes the Zasco's phenomenon? And the correct answer is option A, post-mortem tendon reflex after death. The next question is a patient with an abnormal gait and hearing problems undergoes biopsy of the suspicious mass which had antennae A and B areas with Verroque bodies. What is the likely diagnosis? And the options were schwannoma, meningioma, medulloblastoma, and glioblastoma. And the correct answer is option A, schwannoma. Next question is child with visual defect had suprasellar mass which had wet keratin as findings, and the diagnosis was asked, and the answer is option A, craniopharyngioma. The next question is thyroid tumor with chromogranin synaptophysin positivity is likely to be, and the options were anaplastic cancer, medullary thyroid cancer, papillary thyroid cancer, and follicular thyroid cancer. The correct answer is option B, medullary thyroid cancer. The next question is recommended cholesterol levels to prevent coronary heart disease, and the correct answer is 100 mg per 1000 kilocalories. The next question, a patient with swollen fingers is likely to be having, the image was given, and the answer is option C, wet gangrene.